A very important topic, often confused topic. Most of the students want to reinforce their knowledge on bladder function and the disorders. What we will be discussing is what is the function of bladder and what is the nerve supply. What you should understand is whether it is a filling dysfunction or a voiding dysfunction. These are the two basics. And what is the association with other neurological disorders? What is the innervation of bladder? Sympathetic and parasympathetic. Sympathetic innervation is from T10 to L2 via the inferior hypogastric nerve and hypogastric plexus. Very important, these are inhibitory. It is for filling. What does parasympathetic do? It facilitates bladder emptying through S234 pelvic nerves, that is nervi erigentis and pelvic plexus. Facilitates bladder emptying. Somatic supply, somatic nerves by S2, S3, S4. Bladder sensation and controls are done by pudendal nerve. What is the importance? What you need to know is sympathetic inhibits the sphincter and bladder fills. Once the bladder is full, parasympathetic facilitates bladder emptying by relaxation of the sphincter muscles. What is the reflex arc? The spinal reflex arc is afferent from the stretch receptors in the bladder wall, which sends the distension of bladder. They carry the sensation to detrusor center for micturition in S2, S3, S4 segments of spinal cord. Efferent starts from the spinal parasympathetic innervation via the pelvic nerves, pelvic plexus, short postganglionic fibers to the bladder wall. What happens? With the control of sphincter, parasympathetic empties. Sympathetic controls the filling.